Good morning, everyone. Hope you and your family are safe and healthy. My name is Asmaa sabeeh and I'm a second grade dentistry student. These movements appeared on the screen, which are nodding and shaking of the head, that you maybe do like 100 times through the day. Do you know what part of your body helps you to do them? I'll let you know through my presentation, which is occipital aspect of the skull. The content of this presentation are introduction of the occipital region, borders and sutures, articulation, muscle attachment, surfaces and parts, blood supply, lymphatic and nerve supply, function, and finally clinical significance. The occipital region has a shape that differs according to the species. It is prominent in carnivores and pigs, but very faded in goats and sheep. And what we are going to talk about in details is the occipital bone in human, which is located at the back and lower part of the cranium. It's trapezoid in shape and curved on itself. The occipital bone has a large oval aperture, which is called the foramen magnum, through which the spinal cord and the accessory spinal nerve will pass. From the inferior view of the occipital bone, we can see the foramen magnum clearly, and lateral to it there is the occipital condyles. Also, we can see the inferior nuchal line and superior nuchal line. From the posterior view, we can identify three important structures, which are the external occipital protuberance and the inion process on it. We can see the superior nuchal line and inferior nuchal line and part of the occipital condyles. That's the external protuberance from the lateral view, and that's it from the posterior view. The occipital bone is bordered by several sutures. The lambdoid suture, which bordered it superiorly and laterally and will separate it from the brachial bones. The occipital mastoid suture, the joint between the occipital and the mastoid process. The petro-occipital suture, that joint between the petrous part of the temporal and the occipital bone. Also, we have the spheno-occipital suture between the occipital and the sphenoid bone. Disappear as they fuse during adolescence. The occipital bone will articulate with 6 bones, unpaired and paired bones. Unpaired single bones, which are the articulation of the occipital with the sphenoid through the spheno-occipital suture, and the articulation of the occipital with the atlas, which will form the atlanto-occipital joint. And we have its articulation with the paired bones, parietal bone and temporal bone, with the parietal bone through the lambdoid suture, and with the temporal bone through the petro-occipital and occipital-mastoid sutures. There are so many muscles attached to the occipital, like the trapezius and the sternocleidomastoid within the superior curved line. The most important muscles are the suboccipital muscles, that located below the occipital, and they are four paired, two oblique and two straight. The oblique are the obliquus capitis superior and obliquus capitis inferior. The straight are the rectus capitis posterior major and rectus capitis posterior minor. The occipital bone, like other 7 cranial bones, has outer and inner layers. From the outer surface of the occipital bone, we can identify 5 important structures, which are the external occipital protuberance with its inion process, highest nuchal line, superior nuchal line, inferior nuchal line, the external occipital crest or medial nuchal line. Also, we can see the occipital condyles. From the inner surface of the occipital bone, we can see the internal occipital protuberance and the internal occipital crest, the clivus in front of the foramen magnum. Also, we can see the carciform eminence, which is a cross-shaped lines that will divide the internal surface of the occipital into 4 fossae. Parts of the occipital bone. Basilar part sits anterior to the foramen magnum and adjacent to the petrous part of the temporal bone. Interiorly, it will fuse with the sphenoid bone to form the clivus during adolescence. Pharyngeal tubercle, which is a little protuberance, stands up in the middle portion of the basilar part. Lateral part, located lateral to the foramen magnum. On their undersurface are the condyles for articulation with the atlas. Posterior to them are the condyle canals where the condylar emissary vein pass. And we have the largest part of them, the squamous part, which is located above and behind the foramen magnum. The external surface of the squamous part has the external occipital protuberance and the three curved nuchal lines. The squamous part of the occipital bone is marked by grooves on its internal surface due to the dural venous cranial sinus, the superior sagittal sinus, the transverse sinus, and the sigmoid sinus. The occipital area receives the blood supply from the occipital artery, which arises from the external carotid artery opposite to the facial artery. Its path is below the posterior belly of the digastric to the occipital region. The occipital region blood drains via the occipital vein, which originates from the small vessels on the posterior aspect of the scalp, and drains the superficial muscles and the skin of the occipital region. The occipital lymph nodes are located posterior to the occipital artery and vein, with the occipital lymph vessels draining into the jugulo-digastric lymph node, which then drains into the jugular lymph vessels. Nerve supply of the occipital region. Sandwiching the occipital artery and vein is the lesser occipital nerve branch anteriorly, and the greater occipital nerve branch posteriorly, branch of the spinal nerve. The posterior auricular nerve innervates the occipital belly of the occipital frontalis muscle that covers much of the surface area of the occipital bone. Function of the occipital bone. The occipital bone has various functions. The most important one is protecting your brain and its visual processing center. The occipital bone helps you to nod and shake your head throughout the day by its articulation with the atlas that will form the atlanto-occipital joint. Because of its location, the occipital bone affects all types of body movement, and when the occipital bone is moving or functioning incorrectly, a number of physical and mental health problems may be developed. This may include headache, especially migraines, neck, shoulder, and back pain, coordination and balance problems, vision difficulties. As we stated previously, the occipital protects the brain's visual processing center, lowered immune functioning, sensory processing disorder, and nervous system problems. Clinical significance. The occipital bone is sensitive to the birthing process and in some cases can become injured or damaged during childbirth. The occipital bone can also be affected by other traumas or injuries. Trauma to the occipit can cause a fracture of the base of the skull, called a basilar skull fracture. Occipital hematoma. A hematoma collection of blood in the occipital region. An occipital hematoma may be either subdural or epidural. Genetic disorders can cause a prominent occipit, as found in Beckwith-Whitman syndrome and Edwards syndrome, so the identification of the location of the fetal occipit is important in delivery. And this figure here shows the breast fracture of the left skull. This figure shows a child with Edwards syndrome, and thus the left posterior occipital skull fracture. Thank you for your attention, and remember to stay home and stay safe.